Shalom. Welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabados of Delmar. We have a very, very special guest with us today, Dr. Richard Propp. Dr. Propp, welcome to the Jewish View.
Thank you very much. It's a pleasure to be here.
Well, Dr. Propp, you had a long history in Albany. Went to Albany Medical, and went to Harvard. And actually, you were in private practice, but then became part of the Division of Health, went into the state, and now really you're, if I can say it's independent, you're with the Capital District Alliance for Universal Health Care. So maybe you'll tell us about instead of your whole biography of everything you have accomplished, tell us about your latest venture that you're into now.
Yes, I've led a rather checkered career, but it's been a very rich experience being in academic medicine and doing research and teaching, and then private practice and teaching, and then got a little tired and needed a change and went with the state health department. And how I got into healthcare reform, I was medical director of the Patient Safety Center in Delmar, and I came across data from Peter Ben Brigham Hospital and Harvard Medical School showing that people who were uninsured in their 50s had a mortality rate that was 50% higher than the uninsured in 8 years. So if you have diabetes, congestive heart failure, or high blood pressure, and you're uninsured, your 8-year survival rate is 50% less than if you're uninsured. That would be 12% 8-year survival if you're uninsured, and 18% survival if you are insured. So I was very struck by these figures, and I wanted to get into working on health disparities and disparities in healthcare access. And I went out into our synagogue and convinced the Social Action Committee that this is an important thing to try to do. And we got other synagogues and churches and independent civic people onto our committee, and we've held 88 monthly meetings since June of 2005. So we've had a chance to study the situation and learn a little bit about healthcare.
Obviously it's a good thing, nothing to disagree about, but I mean, I remember that Governor Pataki gave the New York State, at least, I don't know about any other state, but we're in New York State, like, isn't there health care for everybody now?
There are health care programs. There are good health care programs, Medicaid. There's family health care programs. But the fact remains that in New York State, we have 2.6 million uninsured out of a population of around 19 million, and probably another who are underinsured. That is, when they get sick, they have severe financial problems. If you come down with cancer, there can be limits on your health care. And there are about 700,000 children who are uninsured despite the presence of Medicaid.
Well, I didn't know that much. I just thought it was also really universal, so there really is a gap there. On a practical note, though, I mean, what about the dollars and cents? I mean, that would be the counter argument. It's nice, all these programs, including your program. Like I say, I don't know if anybody would disagree, don't give that person health insurance. On the other hand, the other counter argument would be, how much is it going to cost us?
Well, that's a good question. What do you think the person costs us with advanced colon cancer coming into the hospital compared with a person who gets a polyp out from a colonoscopy.
No, I don't know the numbers, but I'm sure it's a great
It's a lot of
difference.
money. It's a lot of money. A colonoscopy may cost $1,000, but if you come in with advanced colon cancer, you're looking at tens of thousands of dollars in health care. But let's go back further, if you'll permit me, to do a little Jewish here.
All right, beautiful. Well, permit you. I love that. Putting on the Jewish views, some Jewish health care, you're saying?
Yes. My favorite quotation is Leviticus 19:18. You shall not take vengeance or bear a grudge against members of your people. Love your fellow as yourself. That's the foundation of the golden rule. So, and also Leviticus 19:16, do not deal basely with members of your people. Do not profit by the blood of your fellow. I am the Eternal. So there's been a lot of ink spilled on what that means. You may have your own ideas, which I would love to hear. But tradition explained, do not stand by idly while another's blood is shed. Do not abandon someone who is in danger. So I think those are very interesting instructions from Leviticus, the law code in the Pentateuch, the Hebrew scriptures. And I think that's a decent place to start in terms of the moral foundation of healthcare. And we have spent a lot of money on healthcare. When Lyndon Johnson introduced Medicare in 1965, they thought it would cost several $billions a year. But Medicare pumped in a lot of money to research and medical advancement and residency and specialty training, and it elevated the level of health care tremendously in this country. And now we spend about $50 billion on Medicare, which is a lot of money, and but it's been a tremendous health care access program.
Also, but I mean, all right. I mean, that's always going to be in anything we do, you know, in anything. Should you buy a new car? I mean, just on a personal level, you have a budget for it, so everything is a matter of, you know, priorities or how much can you budget for it. I mean, obviously, the healthcare is a major. You know, like you always say, even in a bracha, when you give a blessing to someone, the first thing you have is gesund, is health. So what if you know, you have a new car, if you can't drive it, if you're sick, so what do you need a new car for? I mean, and that would be the best thing, the best blessing a person could have.
The health is a very complicated field. There's the health that we get from prevention. There's the health that we get from treatment. There's the health that we get from early diagnosis. There's the health that we get from having a healthy lifestyle. And we've done very well in this country in these fields, but we have a long ways to go. And the Clinton era healthcare reform didn't get us very far in the early 90s. And in the Bush era, the George Bush era, the idea was, well, if you needed health care and you didn't have insurance, go to the emergency room. But that's a very expensive way to do health care, and you are not taking care of your fellow man appropriately. So I think the Obama folks, and the more I study the Obamacare, they had a lot of smart people doing this. And the previous Medicare healthcare reform in 2003, as you know, had a lot of good effects, but it tended to privatize Medicare. And there are people out there today, I would say that there are radical conservatives who want to privatize Medicare further through vouchers. And these people have never liked Social Security, they've never liked Medicare, they've never liked Medicaid, and they would like to get rid of them. I think it would be a tragedy to privatize Medicare. So the Obamacare folks must have been working, I would guess, in 2006 and 2007 and 2008, because this is 2,000 pages of rate laws and regulations. That doesn't come about overnight.
Yeah, I'm sure not.
So they had, I'm sure they had some very good people trying to do this, and Obamacare affects every phase of health care. So it's an overhaul. I took my Ford into the auto shop this morning for routine preventive care service, paid $50 for it, and they changed my tires and rotated my tires. So we give preventive care to the cars, don't we? So do we need preventive care? Yes. So, and prevention is a big part of Obamacare. Let me see if I can find something on prevention here. I've got better coordinated care because I've been studying up so I could know something for this talk here, for this discussion.
Very good.
And I went to healthcare.gov. Now, I don't know the age range of your audience, but many, many people have computers today. Here's an article. Peace of mind in knowing a sick child won't be denied health coverage. Now, that could happen before Obamacare. You've heard of people being cut off from their funding.
Because they make too much money?
No, because they've reached the limit of the policy. I've got prevention and wellness under healthcare.gov. Under this law, many insurers are required to cover certain preventive services at no cost to you. It's a new day for women under the Affordable Care Act. Services to keep you healthy include well woman visits, support for breastfeeding equipment, domestic violence screening and counseling, contraception, and more will be covered without cost sharing in the new health plan starting this month, August 12. Well woman visits, gestational diabetes screening for pregnant women, domestic and interpersonal violence screening and counseling, FDA-approved contraception methods, contraceptive education and counseling, breastfeeding support, supplies and counseling, HPV DNA testing for women 30 or older. That's for a precursor to cervical cancer, HPV virus. Sexually transmitted infections counseling, HIV screening and counseling for sexually active women. Benefits include a yearly wellness visit, tobacco cessation counseling, and a range of no-cost screenings for cancer, diabetes, and other chronic diseases. So whoever was thinking about this and writing up this Obamacare knew what some of the diseases that could be prevented are, and they've got good things going on here for no copays. So there's no barrier for a poor woman with insurance to go to a doctor and get these screenings. They don't have to pay a copay or a deductible. Now that's very cost effective. All of these prevention things are cost effective, because if you come down with cervical cancer, you're in for a very costly illness, or lung cancer from smoking. So I would say that's a win-win situation. Now the problems, we can go into other things, but did you have another question for me?
I mean, I have a few questions for, I mean, so ultimately you're answering me, I said it was very costly. So what you're saying, it's more costly to get sick than these different programs that prevent a lot of diseases. I mean, I don't have the figure. I'm not an expert. I'm not arguing against. I have another take on it. I have a very cursory idea, which I hear. I read a little papers, hear on the TV, in the news. So I'm surely not talking from an expert's viewpoint, but I guess these are the talking points that people throw out. That's going to cost America a fortune if they go through this. And I mean, in a way, you're saying, on the contrary, in certain ways, it'll save money. To prevent the disease is surely more cost effective than running it through the gamut.
Well, let me do one thing that'll save some money, and then somewhat of an overall economic critique of it where there are problems. This came out July 9th. Jonathan Blum, Acting Principal Deputy Administrator and Director, Center for Medicare. If you are like millions of Americans, you have seen multiple doctors or specialists for the same medical condition. And you might have noticed that too often those doctors don't communicate with one another. People tell me about this all the time. And I've had trouble myself coordinating my care. That's not just inefficient, and has the potential to be hazardous to your health. The Affordable Care Act is helping create accountable care organizations, new groups where doctors, nurses, and specialists will work together to coordinate your care. Participation is entirely voluntary. Here's one example of how this works. A California Medicare beneficiary called to say she hadn't been feeling well. Her doctor's office knew she was taking multiple medications for several health conditions. Because she thought she might be suffering from side effects, she stopped taking some of her pills. The office asked the ACO, Nurse Case Manager, Affordable Accountable Care Organization, Nurse Case Manager, to look in on the patient, and the case manager contacted the ACO's pharmacist. The pharmacist then went through each prescription to determine where there might be interactions. He followed up with the patient's specialist to make sure that prescriptions were right, and he followed up with the case manager too. Now that's a lot of work. There's no doctor is going to be able to have time to do that work. And I know a practice now is hiring a nurse, got permission from their managers to hire a nurse to work on these things. But I do know a person who got in trouble with her prescriptions and wound up in the middle of the night, called 911 to go to the emergency room. I tell people, if they're going to go to the emergency room, call 911 and they'll get them seen right away. And that's just the way the system. And she was found to have a low sodium. I'm still not sure why she had a low sodium, but she was on a drug, and she wasn't drinking a lot of fluid or eating a lot. And I wonder if a nurse had gotten involved with the pharmacist, whether that admission may have been avoidable. I don't know, but it just occurs to me. So better coordinated care. That's a good thing to try to do. And there are about, at the present time, across the country, about 300 practices that are doing accountable care organizations. Not a lot, but they'll be able to analyze that and see how it works.
So
Now,
that's a newer phenomena? I mean, that's a newer...
That's a newer idea. Yeah, it's a common sense idea, but how many times do elderly people get confused about their medicines? It's not rare. I have a personal problem list that I keep my medicines on. It's in my wallet. Do you carry something?
No, I know.
You don't?
Why, you mean just the medicines that you're taking personally?
Yeah, and what my problems are.
So why, if anybody needs to know, you mean?
In case I wind up unconscious in the emergency room.
It's good for them to know, you mean?
Yeah, I have it here in my wallet. And I was able to get this onto the New York State Health Department website while I was there. So I have my doctors and their phone numbers and a list of my operations and my medicines, and I have it on my EKG.
Really?
So if I show up in the emergency room, they can look at my old EKG. This is so simple, it's ridiculous, but it's
So therefore, anybody would just look at this, I mean, a doctor would look at this and know exactly who they're
doctors
dealing
love
with.
this. Doctors love this. And you could avoid a lot of problems with a personal problem list. And gets to the topic of what is the patient responsible for? And is the patient literate about their diseases, their problems, their medicines? And I think 50% of healthcare is the obligation of the patient. What do you think?
I mean, that number, but for sure, I mean, it's a matter of overeating, smoking, exercise. These are always, the most basic things you can do about your health, and no one can do that but yourself.
Right. Yeah, you were looking at me with overeating. I mean,
Yeah.
I've had that problem since puberty. But they're also responsible for knowing what their medical problems are and knowing how their medicines work. And I think they should spend some time, we should spend some time on this.
I mean, I'd be educating the patient.
The accountable care organization nurse could be helping the patient learn more about their diseases and their medicines. That would be a good idea.
Yeah, that's why sometimes I have found, I mean, I don't have major medical problems, thank God, but just like even small things where, so, well, here's a medicine. He says, well, why don't you tell me how to take care of myself? I mean, it was just a simple thing like a sore lower back, which, every Jew has or something like that. I always make a joke. But in any case, obviously a lot of people have that. So, okay, here's a medicine. Why don't you tell me how to exercise, So I took upon myself to go to the health club and strengthen my lower back, and thank God I don't have problems. But I kind of, not that, like you say, so obvious, simple, and it's like I had to go to medical school to figure that out. But, on the other hand, no one helped me with that. I had to think around, hey, I don't want to just sit there with pills my whole life. Let me do something to help myself. So I know what you're saying, that, if teaching people how to help themselves would be greatly important.
Absolutely, and if we taught people how to take care of their back, think how much money we could save in unnecessary CAT scans and X-rays and physical therapy. and operations, even operations for low back pain. And this has been well studied, and it's a area of high overutilization and low quality teaching. But you're absolutely right.
Dr. Propp, unfortunately, before you start, we're running out of time, but I think this is so important of an issue. I mean, I think we're going to ask you to come back again because we have to cut now. But, we're going to continue this, and for our viewers, we're going to ask Dr. Propp to come back again for next week, and then he'll be able to tell us more about, about so many things, how to take care of yourself, how to work with your doctor, number two. And, these are all important, how the doctor should work with you and take care of yourself.
And I'll tell you some of the problems with Obamacare.
Good, that's one of the questions I was going to ask, if that is like the
Yeah,
final, so the best solution. But
I'll give you a hint. I'm going to use Joseph Stiglitz's book, The Price of Inequality, as a critique of Obamacare.
all right, excellent. Well, that's stay tuned for coming attractions. You took the question out of my mouth. I was going to ask you about Obamacare, but we'll have to wait for next time. In the meantime, thank you very much, Dr. Propp, to tune us into something that is universal, universal health care. Everybody wants to be healthy. What person doesn't want to become healthy? It's like, that's something that concerns every person. And like you say, the older you get, the more people are concerned with. Obviously, they have more problems. But it's something that, say, the Bible says, surely to take care of yourself, be healthy. And of course, there's kosher laws about it. Kosher laws about eating, but don't say anything about overeating or schmaltz and getting all that fat. So, it goes beyond even kosher, eating healthy, and we're very interested in hearing from you. So thank you, Dr. Propp, for being on The Jewish View.
You're welcome. And remember what Maimonides said, all fat is bad.